Thanks for joining us today. We're here to chat with you about women in healthcare. I am Jillian Hamblin. I'm the Chief Operating Officer for United Healthcare Community Plan of Texas. And joining me today is...
Hi, I'm Tania. I'm the Director of Vendor Oversight and Strategy.
Thanks, Tania. So today we want to talk with you a little bit about what it means to be in healthcare, specifically for women. And I think before we do that, we probably should share a little bit about ourselves, our background, and also why healthcare was the right career decision for us. And so for me, I actually started my healthcare journey right out of college, joining a specialty benefit management company outside of Houston. And I served a number of roles. I started entry level as a project coordinator and moved through project management, program management, ended up in account management and national account management, and then shifted over to United Health Group to kind of pursue a passion in more direct member-facing care, and worked in, again, project management there and clinical operations, and now within general operations for the health plan. And I honestly have always been interested in the healthcare space. As a little girl, I wanted to be a physician. That was a long-term dream of mine that carried forward to college. And for many reasons that didn't pan out. And so leaving college without kind of an understanding of where to go next, I went to my base, which is healthcare, and have been lucky enough to find a number of opportunities that I would be really glad to share were really impactful for me as I built my career. So Tania, what about you and your background?
I actually started my career in healthcare right out of high school. I worked the front end for a multi-specialty clinic here in Austin. So working with everything from an allergist to a urologist. I got to spend a little bit of time doing clinical support work. I got to learn the back end. I'm a certified coder, spent some time in that space. And then later on moved on to work for the state agency, really doing, program development, policy development, project management, implementation, logistics, operations, things of that sort. So I like to say that I grew up in healthcare. It was a great experience for me. I've always wanted to do something in healthcare. I grew up with a brother that was juvenile diabetic since 13 months old. And so for me, it's very personal. And I always knew I wanted to do something impactful, but I also knew that it probably wasn't in the space of clinical. And so what I've really been able to learn in my experience is that there's so much you can do. There's so many lives you can touch in healthcare, even when you're doing that outside of a traditional clinical role.
Yeah, absolutely. And I would say, I think one of the things that drew me to UHG or to United Health Group is the mission. And we say our mission is to help people live healthier lives and help the healthcare system work better for everybody. And the beautiful thing is it takes so many individuals and so much experience to make that a reality. And we truly do live it. I would say for most individuals looking at United Health Group, it's not surprising that we are the second largest employer of nurses in the country, behind the VA. We also employ physicians and social workers, pharmacists, and psychiatrists in varying roles, some being direct patient care, some being program development, policy development, and large-scale solution development. But I think what's lesser known is the number and variety of non-clinical roles that support our vast healthcare system. And so just listening to what Tania shared and my background, you can hear some similarities in project management and program management and operations. I would say in addition to that, we have a huge need for data analytics, IT development and support, especially as we move to integrate systems, which is kind of the call for healthcare right now. A lot in policy and development, operations in general, call centers, member facing, working directly with members to help them connect to healthcare services that they need, provider facing functions, supporting providers and navigating a really complicated system, roles such as legal, lawyers, compliance officers, finance, accounting, accounts payable, all of those functions and more are necessary in order to maintain a structure in healthcare, and are all super critical and probably represent things that you guys do today in other industries. So Tania, as someone who's been in healthcare since you say you grew up, since you were an infant, what is one piece of advice you have for someone looking to break into healthcare?
What I would say is don't limit yourself. The industry We have over 1 million employers here in Texas in the healthcare industry. It represents a $150 billion industry across the state. It is our largest budget item. Without a doubt, it is very, very important. I would say that, if you're interested in healthcare, there's so many things that you can do, whether it's in the space of data analytics, whether it's in the space of member advocacy and member coordination services, whether it's in program development and design, implementing processes that improve the systems, helping us process claims faster, better, more efficiently. There's tons of things that actually can be done in the healthcare space. So what I would say is explore all your options, have conversations, reach out to Julian and I. We're certainly happy to talk to you more about those things. And think about what you actually want to do. I would say that there are tons of opportunities to make huge, impactful changes across the industry. You can impact thousands, even millions of lives in program design, in policy development, and you can do some very, very meaningful things. So the first thing I would say is don't limit yourself and start having conversations. Think about what your transferable skills are, and think about where you would be willing to learn. And we are certainly always happy to teach.
Absolutely. Well, thank you, Tania, for being here today with me. And thank you to all of you who are here with us as well virtually. I hope you're safe, and let us know if we can do anything to help you with your career goals. Thanks, everyone. Bye.